Hello everyone and welcome to the Dental Assisting Chairside course with Carolina Career School. I'm Dr. Kristin Reed and I'm so excited to be teaching the online lecture portion for this course. Over the next 12 weeks we are going to have a lot of fun and you're also going to learn a lot about the dental profession and what it means to be a professional dental assistant. I'm sure you've seen the introduction video, which gives you a little bit of information about why I'm passionate about teaching this course. I'll give you a little bit more information about myself before we get started. This is me and my husband, Paul. We have been married for 10 years. He's a linguist at the University of South Carolina. We have a little four-legged child. This is Jackson. He's an 11-year-old miniature dachshund. Don't let that sweet little face fool you. He can be very, very stubborn. We are both from East Tennessee. We love the mountains. We love to hike. We both love to run and to exercise and travel. Fall in East Tennessee is one of our most favorite times of the year, and you can see why. It's very, very beautiful. As far as how I ended up in dentistry, I guess you could say I have been playing with teeth for a long time. This is a picture of first place in the Blount County Science Fair. I believe that was in 1992. You can see I was playing with wisdom teeth there to determine how common liquids affect tooth enamel. My dad's a dentist and my mom is a dental hygienist, and I can remember probably as a 10 or 11, 12-year-old, my dad teaching me how the proper way to hold a suction chairside so that I could help him with an emergency patient on a weekend. I also worked in his office in the summer developing x-rays. This was back in the day when you had to use film and develop those x-rays in a dark room. So I love dentistry and I'm excited to teach you about this the dental field. It's a great career. I'm excited for you to begin. So let's talk about a little bit about the course information. Obviously, you're able to find me and listen to me, so you were able to successfully log in to carolinacareerschool.com. There you will find the announcements tab. Now that's very important because that is where I will communicate any important information that I need to get to you quickly. That is where you will find that each week. Under the Course Resources tab, you will find any information such as videos or links that I reference in the lecture or PDF files of anything. You will find that there. Under the Meet Your Instructor tab, that is where you will find my email address. You'll also find my phone number there. Please feel free to contact me by email or text or phone. If you have any questions, any feedback that you want as we go throughout this course, this is your course. So I want you to get the most out of it that's possible. So any questions that you have along the way, any suggestions for improvement, I would love to hear it. So that's where you will find my information. In the bullpen, that is a live chat, so if we ever need to get on and have a group discussion, we can do that there. We're also going to be using a private group on Facebook where I will post topics for discussion, case studies, questions for thought and discussion. I really want you guys to be interactive and to discuss those questions with me. Like I said, I'll probably have at least one topic per week that I will request that you give us some feedback and discussion on. So let's go ahead and get started. Oh, one more thing, the syllabus, you'll also have that online, and that is going to be your roadmap for the 12-week course. Okay, there's going to be 12 online modules, 12 lectures per week. You'll listen to the lecture. We'll have the discussions that I just mentioned on the Facebook group, and then you'll also have a quiz that you will need to take prior to the Saturday clinical session. Now, in order to attend the clinical session, you have to achieve a 77% or higher on those quizzes. Okay. You'll also have internships where you will actually be putting into practice the skills that you are learning in a real live dental office. All right, so let's go ahead and get started. Module 1 is the dental assisting profession. This is going to be a great foundation just to give you some background information on the dental profession. I know you're ready to jump in and learn about the procedures that we do in dentistry, but this is a very important foundation for you. So in this first module, we have the following student learning objectives: to understand and explore the following through a clinical and online environment. We have the professional dental assistant, the dental healthcare team, dental ethics, dentistry, and the law. Now, each one of those objectives corresponds to a chapter in the Modern Dental Assisting 11th edition textbook. So very important that you read the textbook chapters. So for this module, it's chapters 2, 3, 4, and 5. Very, very important that you read the textbook before you listen to the lecture. I'm not going to simply read the textbook to you during the lecture. I'm going to hit some of the high points and give you some practical information. So if you haven't read the chapters 2, 3, 4, and 5 for this module, go ahead and just pause the lecture and go read, and then come back and resume the lecture. All right, so each chapter, we're going to start with the Professional Dental Assistant, Chapter 2. Each chapter begins with some key terms. Now, over the course of the 12 weeks, you're going to be learning a lot of new words. Learning, the dentistry is, you're going to learn basically like learning a new language. And it's important to learn the correct terminology because you want to be able to communicate professionally with your dental colleagues, with the dental assistants, the hygienists, the dentists. And you also need to know how to communicate with patients on a level that they will understand using non-technical language. So a highly skilled dental assistant is a vital member of the dental team. A typical day in the life of a dental assistant is much more than assisting the dentist chairside with procedures. You are a dental assisting professional. And professionalism is an attitude that's apparent in everything you do and say, both in and out of the dental office. And professionalism is what distinguishes people who just simply have a job from those who pursue a career. And the best dental assistants that I have had the privilege of working with have the attitude of pursuing a career. So we're going to talk about a few of the characteristics of a professional dental assistant. And most offices will have an employee handbook or an employee manual that will give you specific guidelines and expectations for your dress and for your appearance. And the textbook talks about 3 things that are a part of your professional appearance: good health, good grooming, and appropriate dress. And the dental profession, it can be physically demanding, and so it's very important that you are in great health. You need to get a good night's rest. You need to have a healthy diet, and it's very important to incorporate exercise in your day. So the first thing we're going to talk about is your professional appearance. Patients hate going to the dentist. Not all patients, but some patients hate going to the dentist because it's a very stressful place for them. Many of our patients suffer from dental anxiety or dental fear or dental phobia, and you may be one of those patients. One of our biggest jobs is to calm them and to make them feel comfortable and to give them a sense of trust in our abilities. And as they lay back in the chair and look up, they might not feel very confident if they look up and this is the person that they see. Okay? If the person has tattoos all over their neck or arms or face and piercings all over their face. And, this is clearly a very extreme example. It's our human nature to judge people by their appearance, and that's right or wrong. It's very important that first impression sets the tone for the rest of the visit. Now, there's nothing wrong with either of these things. There's nothing wrong with tattoos or piercings, but just keep in mind that some of these things, aren't acceptable in certain professions. One thing I want to remind you is that subtlety is key when dressing for work, and this includes makeup. We don't want to look like Mimi from the Drew Carey show. for one, it's distracting. Also all that makeup is going to end up on the inside of your mask and smearing all over your face and all over everything. We want our hair to be maintained. You don't want it hanging in the patient's face. Our scrubs, that's typically what will be required attire. We want it to be well-fitting. You want it to be ironed or pressed. You want to wear clean shoes. And as far as some tips on laundering your scrubs, my experience is that if you wash them and dry them, and as soon as that dryer goes off, take them out of the dryer and hang them up immediately. A lot of times you don't even have to do any ironing at all. Obviously, we want to practice good, body hygiene. I think it goes without saying that, as medical professionals, we people hold us to a high standard, and we are going to be in close proximity with people. So clearly, we need to, remember to take a bath or take a shower. Remember to apply deodorant. Your armpits are going to be right up in the next to the face of your patient, up next to the nose of your patient. So, although we want to smell pleasant, we don't want to overdo it. Okay. With that being said, with many people have allergies, and sometimes they can be pretty severe allergies to strong perfumes or fragrances or colognes. So this is just a reminder that although we want to smell nice, I definitely suggest that you avoid applying any kind of perfumes that could be the patients could have sensitivities or allergies to. Another scent that can be very distracting and unpleasant for patients is the smell of cigarette smoke. Now, as a dental professional, we want to set the example. As you know, smoking not only increases your risk of oral cancer, but also lung cancer. And as dental professionals, again, we want to set the example, and we want to encourage our patients not to start smoking, and the ones that are smoking, we want to encourage them to quit. And so smoking can be, or a scent of smoke, especially on your hands, that are going to be, definitely in the patient's mouth and face, and even on your body. That can be very off-putting to a lot of people. Okay, so some more characteristics of a dental assistant. The second one is teamwork. Teamwork is what makes the dream work, as some people say. Teamwork, together everyone accomplishes more. And the dental office can be a stressful place, and if everyone's willing to help their coworkers and work together, it really just does make the day go by so much more smoothly. Another characteristic is attitude, and attitude is just the willingness to get along with others. We want to be aware of the news that we share and the personal information that we share with our teammates and our patients. I really prefer a drama-free work zone. We don't want people coming in talking about the fight that they had with their boyfriend or girlfriend or spouse. It's important to leave your home life drama at home, and don't feel that you have to share those details of your personal life with your employer or with your colleagues. You also, want patients to just know general information about you. How many kids you have, pets, a few places you went on vacation. You want to get to know your patients, and you want them to get to know you. But, you also want to think about what you say when you're interacting with your patients. When you tell your patients that your family's sick and you might be coming down with it, or your throat's sore, or you didn't get enough sleep the night before, or whatever reason, that doesn't really make our patients feel confident about you assisting the doctor, and it may even give the doctor doubts as well. So just keep in mind what you say and what you talk about. Others may perceive that differently. Another characteristic of a professional dental assistant is dedication, and that is just taking care of the patient, and that is our top priority as the dental team. The next characteristic is responsibility and initiative, being dependable, arriving on time, staying your whole shift, not asking to leave early, or constantly calling in sick. The initiative part of that is, do you go above and beyond? And this is going to be especially important during your clinical internships. Do you show that you are excited about dentistry and you are ready to learn and that you are eager? And so I just want to encourage you as you are in those clinical internships to jump in, ask questions when appropriate, and really show that you are motivated. You never know, the dentist that you're doing your internship with may end up deciding to hire you. Another aspect or characteristic of the professional dental assistant is confidentiality. Everything said or done in the dental office must remain confidential. You can't talk about the patient. Say if you're out to dinner, in the evening after work, you can't talk about patients that you saw that day or celebrities that were in your office or whatever the case may be. There are laws, the HIPAA laws in particular, which is the Health Insurance Portability and Accountability Act, and we're going to discuss that more later. But confidentiality is very, very important. One aspect of confidentiality is social media. You certainly don't want to discuss in a public setting on social media, that you had horrible patients that day, or your employees or that your colleagues are just horrible to work with, or your boss is awful. You want to be really, really careful about what you put out on social media, because those things are out there forever. So what are the educational requirements to becoming a professional dental assistant? The Dental Assisting National Board, or it's often referred to as the DANB, they are the ones that test and issue the credential of the Certified Dental Assistant, or a CDA. Now, the CDA credential is voluntary in the state of South Carolina. Depending on what state you're in, you have to check with that state's dental board to determine what the requirements are to be a dental assistant in that state. Now, there's several benefits to earning and maintaining your DANB certification, or your CDA. It's a great source of personal pride. It's a sign of commitment to your profession and lifelong learning. And it may have professional advantages and potential for career advancement, and even potential for greater earning power. Now, if you want more information about that, you can go to danb.org, danb.org, and on that website you will find the pathways for eligibility to becoming what they call a certified dental assistant. There's a couple different ways. The first is to graduate from an accredited dental assisting program, or you can complete a minimum of 3,500 hours work experience as a dental assistant, and that is accrued over a period of at least 2 years to a maximum of 4 years, and that has to be verified by a licensed dentist. But that allows you, either one of those pathways allows you to be eligible to take the exam to be a certified dental assistant. And that exam consists of three different components. There's a general chairside assisting test, and a radiation health and safety test, and then there's also an infection control test. As a dental assistant, you also have the opportunity to belong to the professional organization, the American Dental Assistants Association, the ADAA, and you can find more information on their website, and I have that listed there on this slide. There are lots of benefits, to organized dentistry. You have lots of opportunities to attend local, state, and national meetings, and they also provide continuing education. And the organizations a lot of times will also have benefits like insurance options and discounts on different services. As a dental assistant, you have a lot of different career opportunities, and that includes in a variety of settings, as you can see here, in solo practice where you have one dentist, group practices where you have multiple dentists practicing in one location, You could work in a specialty practice as a dental assistant, and we'll talk more about what those specialties are in a minute. You can work in public health dentistry at a health department dental clinic. You could work in a hospital dental clinic, or in a dental school setting. And within those different settings, there are lots of different roles as a dental assistant. You can become an office manager. There are financial coordinators, scheduling coordinators, insurance. You can work for insurance companies helping to review claims. You can teach dental assistants, and you can also work as a dental product sales representative. So let's talk a little bit about the roles of those dental assistants. There's kind of three main types of dental assistants: a chairside dental assistant, an expanded functions dental assistant. In the state of South Carolina, they call that an expanded duty dental assistant, and also an administrative assistant. And we'll go into more detail in each of those and what their functions are in the next chapter. It's important to note that each state has a list of approved procedures that you are legally allowed to perform, and it's up to you to know what those procedures are that you are legally allowed to perform. All right, so chapter 3, we're going to go ahead and move on to the next chapter. That is the dental health care team. Now, we work hard in the dental profession to take care of our patients every day, and we want to provide them with quality dental care, but we also like to have a lot of fun. So this is something that my team and I did for fun a few years ago when the Harlem Shake was popular. All right, so that was a So the dental healthcare team, chapter 3, we're going to be discussing lots of new terms, and it's important that you are able to converse in this new language and talk with your colleagues and be able to talk intelligently about and to understand and know all the different specialties. So let's go ahead and talk about the members of the dental healthcare team. So of course the first one that we're going to talk about is the dentist. You've got a general dentist, and you'll see the DDS and DMD. DDS stands for Doctor of Dental Surgery, DMD, Doctor of Medicine and Dentistry, or Doctor of Dental Medicine. And those are the same degrees. Some dentists, I have a DDS. I went to the University of Tennessee. A lot of the dentists in South Carolina that attended MUSC, they have a DMD, and that's just because it's up to the universities to determine what degree is awarded, but both degrees use the same curriculum requirements. All right, so within dentistry, you have general dentists, and then you also have specialties or specialists. And there are 9 recognized specialists within dentistry, and those specialties are dental public health. Okay, that is the part of dentistry that deals with preventing and controlling dental diseases and promoting dental health through organized community efforts. Okay, the next specialty is endodontics. Endodontics is the branch of dentistry that is concerned with the dental pulp, and that is another word for the nerve of the tooth. Okay, those are the specialists that do root canals. The oral and maxillofacial pathologist, okay, that is a specialty of dentistry and a discipline of pathology that deals with the nature, identification, management of any of the diseases that occur in the oral and maxillofacial region. The next specialty is oral and maxillofacial radiology. Okay, this specialty of dentistry uses they're concerned with the production and interpretation of images through whether it be through X-rays or probably one of the most recent additions to dentistry is the use of the cone beam technology or cone beam CT. They're going to be using those. The next specialty is oral and maxillofacial surgery, and that is the specialty of dentistry that deals with diseases, injuries, and defects, both in the functional and aesthetic aspects of the hard and soft tissues of the oral and maxillofacial region. So that's your oral surgeons. They do a lot more than just wisdom teeth extractions. They can treat patients who have had facial trauma, patients who have skeletal abnormalities that need to be corrected. The next specialty is orthodontics and dentofacial orthopedics. That's a specialty that includes the diagnosis, prevention, interception, and correction of malocclusion, as well as neuromuscular and skeletal abnormalities, and that's orthodontics. They not only treat children, but they also treat adults as well with braces. Pediatric dentistry. Pediatric dentistry is age defined. Okay, it provides both primary and comprehensive preventative and therapeutic oral health care for infants and children through adolescence, and they also see those people with special health care needs. The next specialty is periodontics, and that involves the prevention, diagnosis, and treatment of diseases of the supporting structures and the surrounding tissues of teeth. So they're what I like to call gum and bone specialists. Prosthodontists, that is the dental specialty that pertains to the diagnosis, treatment planning, and rehabilitation and maintenance of oral function, comfort, appearance, and health of patients with clinical conditions associated with missing or deficient teeth. And oftentimes they are involved in cases of complex restorative cases that maybe the general dentist doesn't have the training to be able to deal with those types of cases. And as a dentist, we rely on our ability to communicate and to work as a team with all of these specialties. A lot of our patients require input from multiple of sources and multiple specialties, and so it's fun to be able to work together as a team. The next member of our dental healthcare team is the dental hygienist or registered dental hygienist, or RDH. The dental hygienist provides prophylaxis, or another word that you'll hear for that is a prophy, and that is the non-technical term would be a dental cleaning. They also provide scaling and root planing procedures, which those are procedures that you will learn to treat gum disease or periodontal disease. They also expose radiographs. They apply fluoride and sealants. And a large part of what they do is providing patient education. The next person on the team is the clinical dental assistant. This is the person that works chairside with the dentist using four-handed dentistry, and that is a concept when the dentist and one dental assistant work together, hence four-handed dentistry. And one of the most important things that you'll hear talked about in regards to the four-handed dentistry is learning to maximize efficiency. That is so important. You want to do what you can, and the more efficient that you can be, the better. And so part of efficiency is being prepared, having all of the necessary items and instruments and things that you're going to need for that procedure, have them out and ready. That minimizes the amount of times you have to get up and go run for something, and minimizes the amount of time that we have to stop the procedure to get something that we're lacking. So you'll hear a lot about maximizing efficiency in four-handed dentistry. As a clinical dental assistant, there will also be a circulating dental assistant a lot of times. That's just an extra pair of hands when that's needed, and so a lot of times we'll refer to that as six-handed dentistry. Oral surgery utilizes a circulating assistant quite a bit. Another type of clinical dental assistant is a sterilization assistant. Some offices have a dedicated assistant to perform the sterilization procedures for the instruments. In other offices, all of the assistants share these responsibilities. There's also a hygiene assistant. Not all offices have a hygiene assistant, but in the offices that do, this assistant assists the hygienist, and they may seat the patient, they may take the vital signs, they may expose the radiographs. A lot of times they'll help assist the hygienist in charting. They a lot of times also will schedule appointments. So it depends on the office where you are and the different types of clinical dental assistants that they utilize there. The next member of the dental healthcare team is an expanded functions dental assistant. And as I referred to earlier, in South Carolina, that is referred to as an expanded duty dental assistant. And again, it's important to refer to your state's dental board for a list of those approved procedures, because it does vary by state as far as what procedures you are legally allowed to perform. Another member of the healthcare team is the business assistant. This is the person that schedules the appointment, communicates with patients on the phone, coordinates financial arrangements with the patients, handles dental insurance claims, among many other things. And again, many offices will also have other positions such as, and I touched on these earlier, such as office manager, treatment coordinator, and insurance coordinator. It really just depends on the office and what they have available. The next member of our dental healthcare team is the dental laboratory technician, or certified dental technician, CDT, and this is the person that makes the crowns and bridges and partials and dentures from the impressions that are taken by the dentist and sent to the laboratory. Most offices do not have a dental technician in the office. Some do, but most of the time it is an outside laboratory that they will send those impressions to for the fabrication of those dental prostheses. The dental technician, the laboratory technician, is only legally allowed to perform those tasks that are specified by the dentist, and that requires a written prescription to accompany that impression. And it's really important to have good communication with your lab technician. That is how you're going to get the best result for your patients. And as we go along in the course, we will touch on that a little bit more. The next person is your dental supply person. That is your dental rep. And there are a few large dental supply companies. You may have heard of some of them before. Patterson, Henry Schein, and Benco are just a few of the big name companies. And this dental supply person is a representative that works for that supply company, and they take orders for supplies, the dental supplies that we use. They may provide new product information, and they are also oftentimes the person that will help arrange for service and repairs of the equipment in your dental office. And a lot of times they'll visit the office frequently to make sure that you have the supplies that you need, and that you are aware of any new products that are coming out. And as a dental assistant, you typically are the one that's going to communicate the most with the dental rep, as usually it's the dental assistant's responsibility. There's usually one dental assistant that's is the dedicated supply assistant, and it's your responsibility to maintain the inventory of supplies, and also you'll be the one that'll be ordering those dental supplies monthly, so you'll have a lot of contact with your dental rep. Now, the next person on the dental healthcare team is the detail person. And this is a representative of a specific company, like a drug company or a dental product manufacturer, like Oral-B or Colgate. And these people will visit the office and they provide the dentist and the dental team with information about a specific product. Like they may have a new electric toothbrush that's come out on the market, or a new Listerine that's come out on the market, and so they will come and provide, and a lot of times they'll do what they call lunch and learns, where they provide lunch and they teach you about their new product. The next person on the dental healthcare team is the dental equipment technician, and this is the person that installs and maintains dental equipment, and a lot of times they work for the same company as the dental supply rep. So a lot of times the dental office may have a contract with Patterson or Henry Schein, so that if they have an equipment breakdown or maintenance that's required on their equipment, they will have a contract with these companies. So you just call them when you have a need for them to come and help you out with your equipment. All right, so hopefully nobody's snoring, and hopefully I have not put you completely to sleep. This is Jackson right here, and this is my mom and dad's dog. We kept him while they were out of town last summer, and he's just making himself at home. This is actually Jackson's bed, and I think he was just too tired to even get totally in the bed. So anyway, hopefully you are still breathing, hopefully you still have a pulse, and hopefully you're still hanging in there with me. All right, so let's move on to Chapter 4, Dental Ethics. The public places a great deal of trust in medical and dental professionals, and we have a responsibility to uphold that trust. So we're going to talk about ethical standards versus legal standards. So ethics refers to what you should do and why you should do it, not what you must do. The law is what deals with what you must do. Ethical standards are always higher than the minimal standards which are established by the law. And for example, a behavior can be unethical and still be legal, but it can never be illegal and still be ethical. So what are some sources for our ethics? Basic instinct, our parents, teachers, religion, and observation of other people's behavior. So what are some basic ethical principles? And this terminology can be found on table 4-1. Autonomy, that is, patients have the right to participate in decisions that are related to their dental care. So they have the right to refuse recommended treatment. Non-maleficence, that means do no harm. You've heard it said before, the Hippocratic Oath, do no harm. Patients want the dentist to provide a treatment. Patients oftentimes will want the dentist to provide a treatment that the dentist believes is not in the best interest of a patient. So sometimes the patient may want something, but we feel like if it's going to do them harm, we can't do that. A lot of times, patients will want us to, for example, put a crown on a tooth that may not even be restorable, and so we have to do our job to explain the condition to the patient and let them know that that would be doing them harm. The next ethical principle is beneficence, and that is actions that are beneficial to a person or community. An example of that would be volunteering in a dental health education program. A lot of times schools or teachers will ask us to come in and provide education to students on dental health care. The next principle is justice, and that is all patients deserve to receive the same quality of dental care, and that's regardless of their socioeconomic status, their ethnicity, their level of education, or their ability to pay. The next ethical principle is veracity. That means being honest with the patient regarding their dental condition and their dental treatment. And the last one is confidentiality, and this is the patient's right to privacy. And we touched on that before about HIPAA. And again, confidentiality in the dental office is very, very, very important. It's taken very, very seriously. One other thing that is an ethical principle is continuing education, and this is maintaining and updating your knowledge and your skills. The dental board for each state is the one that determines the number of continuing education hours that are required to renew your license. But continuing education just shows your commitment to learning, but it also the dental field and medicine in general, the amount of information, the amount of new information, the rate at which things change is just very, very quickly. So it's very important to stay up on the latest techniques and the latest equipment and the latest products to use. All right, so we're going to go on to the professional code of ethics, and the code of ethics just serves as a method of voluntary self-regulation within the profession. So in other words, this is the ideal behavior for the members of that profession. It demonstrates the standard of care. It enhances the awareness and responsibility of the members of that profession, and it helps us make informed ethical decisions. And it also establishes a standard for our professional judgment and for our conduct. And that professional code of ethics and those ethical principles that we just discussed, that is what helps us to apply those ethical principles in everyday life and some ethical dilemmas that we may face. Now, your textbook gives some excellent examples, case examples of applying these ethical principles as it relates to the dental office. It also talks about ethical dilemmas and when one or more of these ethical principles are in conflict and how we resolve those. So we will definitely be discussing this week on our discussion board some of these situations, and we'll get to dive into a little bit more detail about those. All right, so moving on to Dentistry and the Law, Chapter 5. So statutory law is legislation that was passed by the U.S. Congress, a state legislator, or a local legislative body. And statutory law is divided into two categories, either criminal law or civil law. And criminal law includes felonies, which are major crimes like insurance fraud, drug abuse. It also includes misdemeanors, which is a lesser offense that could lead to fines or loss or suspension of your license, mandatory CE, counseling, or community service. An example of that could be failing to follow appropriate infection control regulations as outlined in your state's Dental Practice Act. And we've all heard stories in the news of dental offices that get in trouble for not sterilizing their instruments properly. So that would be an example of a criminal law. Another type of statutory law is civil law. And there's three different types of civil law that we're going to discuss. Contract law, which is a binding agreement between two parties. So this may include employment contracts, a contract that you may sign with your employer, or it may be a contract for patient treatment. And those contracts can be expressed or implied. Now, expressed means a written consent, like a written consent form that you ask a patient to sign after you've informed them of the procedures and the risks and the benefits of that procedure. Implied is established by action. So the patient sits in your chair and they open your mouth for you to examine their teeth. They didn't have to sign a consent form for you to do that. That's just implied because they are sitting in your chair. The next type of civil law is tort law, and that involves actions which could be intentional or unintentional that bring harm to a person or damages to property. And so an example of this would be a malpractice suit where the patient alleges that the dentist caused them some type of harm. That could be either acts of omission or acts of commission, and we're going to talk about that just a little bit more in a minute. The third type of civil law is administrative law, and that involves the regulations that are established by the government. So, an example of that would be like a violation of OSHA, the regulations, and those regulations are intended to keep employees safe while they're on the job. This would also include the Dental Practice Act, and that is what gives the legal requirements for the practice of dentistry within each state. And if you want to find out what your specific state's Dental Practice Act consists of, you can go to the ADA website, ada.org, and they have links to each state's Dental Practice Act. So each state has a board of dentistry, and they are the governing body that interprets and implements the state regulations. Now, for the state of South Carolina, our dental board, you can find their website at llr.sc.gov. They also are responsible for licensure, giving the license to practice dentistry, and that's one way that they can supervise the people who are practicing in that state. The next topic we want to discuss is respondeat superior, and that is the concept that the employer, usually the dentist, is responsible for any harm caused by the actions of the employee while the employee is carrying out the business of the employer. So in other words, the patient may sue the dentist for an error committed, by the dental assistant. If the dental assistant, you're removing a temporary crown from a patient and the patient aspirates the temporary crown, the dentist could potentially be, even though the dentist was not the one that caused the incident, they can still be responsible for that, any harm caused to the patient. But it's important to know that the employee is also responsible for his or her actions, and the injured patient may also file a lawsuit against the dental assistant. So there's several types of supervision we're going to talk about: direct, indirect, and general. And so direct supervision is when the dentist is in the office. They personally diagnose and treatment plan the conditions that need to be treated. They authorize the procedures, and they stay in the dental office or the treatment facility while those procedures are being performed, and then they evaluate those procedures before the patient's dismissed. Indirect supervision is a type of supervision where the dentist is in the treatment facility, and he or she has personally diagnosed and treatment planned the condition. They authorize the procedures, and they remain in the treatment facility while those are being performed. They may not be directly in the room while those are being performed. Now, general supervision is a type of supervision in which the dentist is not required to be in the dental office or the treatment facility when the procedures are being performed, but they have personally seen the patient, they diagnosed the treatment, and provided the treatment plan, what needs to be done. So again, each state, the dental board will have a list of what they consider legally appropriate procedures, and what type of supervision that those types of procedures require. So it's very important that you know what those procedures are, and I will give you a link to the South Carolina State Dental Act, so you will know, if a dentist asks you to do something that you're not legally allowed to do, you don't want to be doing that. Is performing those procedures that are not legal in your state, that's considered practicing dentistry without a license, and that's a criminal act. And ignorance is no excuse under the law. So you're held to the standard of what your procedures that you're legally allowed to do in that state. So some other concepts with dentistry and the law: the standard of care, that is a term which describes what we want to do, what kind of care we want to give to the patient. What's the standard? Being licensed, using reasonable skill, care, and judgment, using standard drugs, materials, techniques on the patients, and there's a few others that are listed in the book that define what the standard of care is. So the next topic is abandonment. Abandonment is discontinuing care after treatment has begun, but before it has been completed. So an example of this would be a dentist decides to just close the practice without giving a proper notice to the patients or without making arrangements for the continuation of their care. That would be abandonment. Another concept is patient responsibilities. We expect patients to pay a reasonable, predetermined fee for the services that we provide for them. We expect the patients to cooperate and follow instructions regarding treatment and regarding any home care, post-op instructions that we give them. And, it's important to document non-compliance. We're going to discuss this more in the coming lectures on clinical notes and documentation of treatment. But it's important to note, when we have given patients specific responsibilities or specific instructions, and they choose not to comply with that. Malpractice, that refers to professional negligence or failure to provide that standard of care. And that involves acts of omission. And acts of omission is you omitted to do something. You failed to perform an act that a reasonable and a prudent professional would perform. So like you didn't take x-rays before you took a tooth out, or you didn't take x-rays before you in order to evaluate the patient's dentition or their teeth to determine if they had periodontal disease. So another type of malpractice could be an act of commission or committing something, performing an act that that a reasonable and prudent professional would not perform. So, for example, your book gives the example of administering 15 carpules of local anesthetic to a small child. That would obviously definitely result in a potentially life-threatening overdose. Okay, so that would be doing something that would result in harm. The next concept is res ipsa loquitur, and that is the act speaks for itself. That just means the evidence is very clear. So an example of that would be, the dentist extracts the wrong tooth. That's an example. All right, so let's talk about risk management. Your book gives some excellent suggestions for ways to manage that risk and potential litigation. The first one that they discuss is excellent communication with patients, and that is absolutely key. It's important to that the patient, again, be aware of the procedures that you're recommending, and it's important to document those conversations. It's important to document any kind of communication, whether it be in person, whether it be on the phone, email. Definitely document that. You also want to maintain accurate and complete records. If it's not documented, it didn't happen. Okay, so it's very, very important. And as a dental assistant, you will help in maintaining and completing those records along with the dentist. Part of risk management is receiving informed consent from the patient, both written and verbal. In our office, we require written informed consents for all procedures that we do. We want to do everything possible to maintain the highest standard of clinical excellence. That's definitely another way to assist with risk management. The last concept here is res gestae. Okay, and that is not making critical remarks about dental treatment. You don't want comments such as whoops or uh-oh, because those types of comments that are made, if a negligent act were to occur, those can be used in a court. Okay, and along with that, it's very important that we don't say critical things about other dentists, about other dental offices, about others in the dental community. As dentists, we oftentimes we work as a team, and there's just no place for bashing other dentists and making critical remarks about others in our profession. So let's talk about the importance of good communication. I touched on that in the last slide, but part of good communication is informed consent. The dentist explains the patient's condition to them and all treatment options, including the risks and benefits of each option. Another part of good communication is informed refusal. If a patient refuses treatment, which they have the right to do, they need to be informed by the dentist about possible consequences of no treatment, and to make sure that they understand, what could happen if they don't, and continue with the treatment that the dentist recommended. This exceptions to disclosure. The dentist does not have a duty to disclose information about proposed treatment. There's 4 situations that are outlined in your book. Another topic is informed consent for minors, and each state may differ in what is considered a minor, so it's important to know what your state's classification of a minor is. But one of the topics that's talked about in your book is asking in advance for a parent's blanket consent. That is for emergency treatment, and that avoids confusion and delays in treatment should the child have an emergency situation when emergency care is needed and the parent's not present. That just gives a healthcare provider the ability to treat that patient. The next thing that we want to talk about is patient referral. General dentists may, or even specialists may refer to a specialist or another specialist when they feel that the patient's condition is beyond their scope of expertise. And a lot of malpractice claims involve the failure of the general dentist to refer the patient to a specialist when their condition requires the expertise of a specialist. So again, we all in the dental community, we work together as a team to help give our patients the best possible care. Another thing that we want to talk about is guarantees. Outcomes of dental care cannot be completely predicted. So the dentist and the dental assistant should not make promises or guarantees about the outcome of care. In many states, guarantees are considered illegal. Another thing that we're going to talk about is patient records. We will discuss this in more detail again later, but we want the patient's record is a legal document, and that contains all the exam records, the diagnoses, the radiographs or the x-rays, the consent forms, the medical histories, the medical, any correspondence we have with the patient's physician, any dental laboratory prescriptions, and any correspondence with the patient. And that may also include contributory negligence. We want to document when the patient's negligence negatively affects their treatment outcomes. Patients that we diagnose as having periodontal disease, and we advise them for the need for periodontal therapy, and they don't comply, we need to document that. Or patients who routinely break appointments and who don't proceed with dental treatment as we have recommended, we want to include that in the patient record. Now, the financial information is technically not included in the patient chart. We'll discuss this in more detail later, but a lot of times with our computer records, you will see all of that information within what we consider the patient's chart. But what this is talking about is more, when you're writing clinical notes for the patient, you really don't want to include financial information in that particular portion of the chart, because you don't want somebody to look at that and think that you were, dictating, or that the finances or their lack of were dictating the treatment, or that maybe you were giving them substandard care because they were not able to pay for the top of the line care. So typically that financial information is included in a separate portion of the patient record, and not actually in the patient chart where we have clinical information related to that patient's oral health. The dentist owns the records and radiographs, but the patient has the right to obtain copies. And it's important to note, if you are working in the front office and another dental office or anybody calls and asks you to, and they say, I've got Mrs. Jones in my chair and I would like to have her x-rays or her records sent over, could you go ahead and email those to me? Well, one of the things that you'll learn with the HIPAA regulations is that patient has to actually sign a records release allowing us the permission to release those records to someone. If you release those records without the patient's written permission, there could be the potential for pretty big fines there. All right, another concept with dentistry and the law is the reporting of abuse and neglect. And dental team members, we may be the first to recognize signs of abuse, whether it be child abuse, domestic abuse, spousal abuse, elder abuse, or dental neglect. And many states identify dental professionals as mandated reporters, and that means that we must report suspected abuse if we observe those signs. And your book gives some great examples and indicators of abuse and neglect. All right, so the next thing that we're going to talk about is HIPAA. There are whole courses on HIPAA, so I'm certainly not going to be covering it in its complexity here. Okay, HIPAA is the Health Insurance Portability and Accountability Act of 1996. The purpose was to provide consumers with greater access to healthcare insurance, also to protect the privacy of protected health information, and to promote a greater standardization and to enhance efficiency in the healthcare industry. So HIPAA, there are kind of three parts that we're going to talk about. The privacy standards, and that is the careful use and disclosure of protected health information, or PHI, and that's what I just discussed about, who we are who does the patient give us the permission to discuss their health care with, who can we release records to. The next part of that is patients' rights. Patients have the rights to view and to copy their health information, and they have the right to tell us who we can disclose that information to. The administrative requirements, we are required to give a patient a written notice of our privacy practices. We have to give those to the patients. So a few kind of tips as far as HIPAA and how it relates to you in the dental office. It's important that we protect our patients' information. Okay, so just think about where patient information could be seen. You don't want to have lots of papers on the front desk, where a patient could walk up and see the patient's name or phone number or address or anything related to that patient care. Computer screens, obviously you don't want to have the schedule on the computer screen, for example, where there's lots of patients' names and information where the patient that's currently in your chair could have access to. You want to be careful not to mention names of patients or any kind of patient information in front of other patients. It's easy to discuss other patients that are in the office that day or coming in later, but you really want to be careful about not mentioning names of your patients in front of other patients. You also, when you're discussing treatment options with a patient or discussing financial arrangements with a patient, you want to be discreet. You want to have those conversations in a private area where other patients, other people are not going to be listening in. All right, so that concludes, you made it, congratulations, that concludes the end of the first module. And I'm going to briefly talk about the clinical session for week 1. Okay, this week you guys are going to become familiar with the dental office. You are going to learn effective communication between dentists, dental assistants, patients, and caregivers. You're going to learn how to greet and situate the patients, how to seat the patient, how to take them from the reception area to the operatory. You're going to identify tooth numbers on a chart and on a dentiform. You're also going to begin to learn and practice how to sterilize instruments. So again, this week we talked a lot about the foundation, and it's very necessary. But this week you're going to go ahead and jump in and begin to learn exactly some things that you're going to be using on a daily basis. All right, we are at the end. Great job hanging in there with me today. If you have any questions, any comments, again, any feedback or suggestions, anything that I discussed today that was not clear, please, please, please just email me. There's my email address there on the screen. And again, under that Meet Your Instructor tab on the website, you can also find my phone number where you can send me a text or call me. I'd be happy to answer any questions that you may have. And I am looking forward to meeting you at one of your clinical sessions, and can't wait to continue on in this course with you. I'll be talking to you soon. Bye-bye.